Hello, good afternoon. Welcome to APHA's first town hall meeting of 2017. You may recall that we held an inaugural town hall event in September, and due to the positive feedback we received, we decided to continue to use this platform to speak directly to you on important issues facing APHA in the field of public health. Today, our town hall meeting will focus on some of APHA's immediate advocacy priorities for 2017 and how you can take action. Presenting today are APHA's Executive Director, Dr. Georges Benjamin, and APHA's Associate Executive Director for Public Affairs and Advocacy, Dr. Susan Poland. With that, it's my pleasure to turn the presentation over to Dr. Benjamin. Dr. Benjamin, the stage is yours.
Hello out there. Thank you very much for being with us this afternoon. You know, as the 115th Congress has already started, and in just 3 days, we will have a new president and administration coming on board. So I wanted to take the opportunity to talk with you about many of our priorities and the strategies that we may go through for the coming year. You know, we can't go into a lot of detail about each of these strategies or priorities, nor am I going to sit down and try to tell you, how a bill becomes law. I assume we all really understand that very well. But I want to give you a general lay of the land. I know there's a lot of anxiety out there. People are very concerned about how we can engage in the public policy process. And all of us are very concerned and passionate about these public health issues. And I just want to reassure you that there are folks that are not really supportive of public health and that they have their agenda. And that we in public health have our agenda. And therefore, we recognize many of the problems. We know that there's going to be a real mountain to climb to try to convince people that prevention and public health is important. And we know that we have fought so hard over the last several years to make real advancements in things that really are working to improve the public's health. And we know that some of those things will be under attack. So we wanted to make sure that you, the public health community, understood that we are still grounded very much in science and the evidence, and that we will continue to use science and the evidence in terms of our policymaking and priority setting. We know that, at least right now, there are three really, really big priorities that are going to hit us literally starting this week. And in fact, many parts of Congress have already begun to unravel some of those priorities. First of all, is the Affordable Care Act. Secondly, funding for many of the public health priorities that we have championed over the years. And the third thing, of course, is that we are looking at environmental issues with climate change and spending a fair amount of time this year looking at this year of climate and health, year of climate change and health. That because we think that's an important effort to rally around many of our environmental health issues. Now, those issues aren't listed in any priority order. We know that right now the Affordable Care Act and efforts to stop repeal of the ACA are in effect right now. Secondly, we know that funding for climate change and public health in general is at risk. And we know that Congress is going to begin, as soon as the administration gets in place, to begin thinking about what their budget priorities are going to be. And we want to talk about how we basically want to influence those. Now, if anyone was not awake, we knew that right after the election, the election outcome meant that efforts to cut back on a system to ensure that everybody has health insurance coverage was in the making. We knew that the ACA was on the table. But I want to remind you what's really at stake. More than 20 million Americans who gain health insurance under the Affordable Care Act will lose it if we lose the ACA. Millions of low-income families who have access to health care through a variety of other venues, including community health centers, are at risk. In addition, every single person who is in this country who receives access to health care through the insurance model are also at risk. So it's not just the 20 million people who will lose health insurance pretty soon with a repeal, but it's every one of us who loses the benefits of the restructuring of our health insurance industry that occurred through the Affordable Care Act. It will also gut the Public Health and Prevention Fund, which has today provided more than $6 billion of support for a whole range of community-based prevention and public health activities in every state in our nation. What folks don't really realize that because of some of the supplantation that happened with the Affordable Care Act, 12% of the budget of the Center for Disease Control and Prevention is at risk. And of course, remind you that more than 70% of CDC's funding goes to state and local communities. So this is really not just a cut at the federal level, but this is a cut to state and local public health as well. Now, the current status is that the House and the Senate have passed something called a budget resolution. And the budget resolution is basically a blueprint. It actually is not binding, but Congress uses it as a binding document in terms of trying to think about how they're going to fund. And so the various committees that are concerned about health, the House Ways and Means, Energy and Finance committees, the Senate Health and Finance Committee will now start working on legislation using that budget blueprint and the rules that that budget blueprint allows them to do to try to go after primarily the funding for the Affordable Care Act. And then once both houses of Congress create their various pieces of legislation based on what the committees do, they will craft that together into, in essence, what's called the reconciliation bill, and then try to really remove funding activity and funding authority from the Affordable Care Act. Now, there's a lot of stuff they can't do through just the funding aspects alone, but they clearly can undermine the financial underpinnings for the Affordable Care Act. It's an arcane process. It's convoluted, but you can really influence it through a range of advocacy activities. And so APHA will be part of the advocacy activities. You may have seen some of the things that occurred just this weekend, just Sunday, in rallies around the country. There were 70 of them, and many of our members, through our affiliates and others, were engaged in those activities at the state level to let our local elected officials understand the importance of the Affordable Care Act in its current form, and that we certainly do not support even a repeal or replace concept, recognizing that that's what they're going to try to do, whether they try to delay pieces of it or whatever, very much concerned with what it does in terms of undermining the insurance markets that we have today. So the Affordable Care Act is something we are still fighting for. We would like for you to make sure that you put that on your advocacy agenda and top and high on your advocacy agenda, because we think it's very important. Also remind you that the Prevention Fund, there are many new members of Congress, and there are many members of Congress whose staff really don't understand the Prevention Fund. It's going to be very important for us to educate people on that. In fact, if you go to the APHA website and type in the search engine Prevention Fund, you'll find a very important document which explains the Prevention Fund. It's about 4 pages, and it's something that the APHA Policy Center did a couple years ago, and we've updated it to really explain to policymakers what the Prevention Fund is and what it does. And this is important because while the federal government is currently operating under continuing resolution, by the way, that goes until the end of April, about April 28th, we don't really know what the next steps will be for the rest of this fiscal year we're in, or the fiscal year 18, which starts on the 1st of October. We don't know how Congress and the administration will choose to fund the government during this period of time, so that we know that there's going to be debate about what should be funded, Congress could come up with a brand new budget that starts after April to the end of September. They could then also craft a new budget for FY 2018, or they could decide to do a continuing resolution just for the rest of the year. But it depends on how quickly the administration, the incoming administration, can craft a budget and submit it to Congress to get that going. We do expect, no matter what happens, that Congress will lower the caps on the budgets that we have right now. Congress is always been interested in reducing funding for a variety of domestic programs. And there's an interest, as many of you may know, to put more money on the defense side of the budget. And of course, with a pie that is fixed, or in this case, Congress trying to shrink, usually domestic programs are the ones that fill the squeeze the most. Now, we know that also that as they do that, Congress, which already has done some things to dramatically reduce the potential further growth of the prevention fund, makes the prevention fund even more important today for us to defend. Now, we've historically taken a lead on public health funding, but we've not necessarily seen the kind of support that we would like from our members for all the advocacy alerts. So it's very important that you, when we send you an advocacy alert, really respond to that as an effort to try to protect public health. You know, now is not the time to retreat. Now is not the time to surrender. Now is the time to, really step up to the plate and aggressively fight for the funding to support the priorities that we and you have for public health. I think that's going to be one of our central challenges and certainly a core message that I want to send out to the field. One of the other things we know is that while we have been strong supporters of the concerns around climate change, you may remember at the close of our closing session of this year's annual meeting last November, we announced that we are going to champion a year of climate change and health. That's an important issue for us. And we just had a summit here, brought many of our partners together. And each month we're going to champion something that's very important around the issue of climate change and our health. We want to make sure that everyone knows that not just the professionals in the field, not just practitioners of public health, but all sectors of society are engaged, thinking and talking about the importance of climate change and health. The capstone event for this activity, of course, is our annual meeting, where the theme is the healthiest nation, climate changes health. So again, just another plug for people to come to our annual meeting this year in November in Atlanta. We think it'll be a wonderful meeting, but there'll be lots of activities that are going to occur, lots of things we're going to do as the year goes on. Many of our leaders around the country speaking on the issue of climate change and health. Our current president, Thomas Quaid, has adopted that as part of his message on climate change. Also, the other part of his message is around health equity. And we know that climate change is an important activity for us if we're trying to achieve health equity, because what we also know is that the most vulnerable of our community are the most impacted by climate change and the least resilient to protect themselves against the changes in climate. So Tom is going to link these two issues together as part of his message. And that builds on Dr. Kamara Jones's work last year in trying to educate us all on structural racism and its impact on our health as well. Speaking to that, I just want to tell you that this is, of course, January the 17th. And one of the things we're also doing is celebrating a day of racial healing with the Kellogg Foundation. We want to just recognize the fact that we have all of these barriers in our society, which don't necessarily value all of us equally. And so today is a day that APHA is stepping up with the Kellogg Foundation and other partners around the country in this day of racial healing. And so I just want to publicly thank the Kellogg Foundation for their efforts, and then to announce that we are involved with that, and this builds upon the work that we've done around health equity, Dr. Jones's work over the last year, and Mr. Quaid's work as we go forward over this next year around dealing with social justice as part of our core public health message. So with that introduction to many of our policy activities, I want to turn this over to the lady who is responsible for making sure that we all get out and march with our feet, our head of our advocacy programs and our policy programs overall, and that's Dr. Susan Poland. Susan.
Thank you, Dr. Benjamin. I want to talk a little bit about actually putting those policies and those priorities into action, what we're trying to do here at APHA and what we can offer you in support of the work that you're doing at the local level. I want to start though by talking about a success actually that we've seen since this Congress has come back in, which is we've offered a template for our members to send to the members of Congress in support of the Prevention Fund, as well as a template op-ed that you can put in your local papers. And we've had great pickup of that. We've seen really strong support, but it can be better. And so we really hope that all of you take this opportunity to request this information. You can request it from Nicole Berta, who is our Senior Manager of Government Relations, and she can send you that information. Because the point is, every single member of Congress needs to hear from us. They need to hear from us, even if they've been our friends and champions, and they need to hear from us if we need to convert them to champions of public health. Because it's only through the voices of their constituents that the members of Congress are going to make any changes. We've actually already seen some of that with some of the early sunlight that was placed on the changes the House wanted to put into their ethics, the way they handle ethics, and that's only the start of the work that we as constituents can do. So please, all of you, take this to heart. Even with all of this, though, we have to consider a slightly different way of accomplishing our goals if we want to maximize our opportunities to become the healthiest nation in one generation. So in a way that's going to be slightly different from what you've seen from us in the past, is APHA is going to be very clear and very focused on our priorities. Dr. B mentioned the priorities that we're starting with. We know there'll be others as we're coming along. But if we want to really limit the damage and we want to move forward on the agenda that we think is important, we need to have an opportunity to be focused. Because we need to be realistic about our limitations, we have to prioritize our work and expectations and find new ways to bring these issues to the forefront, while at the same time recognizing that it can't just be us, the public health community, talking about these issues. We need to bring in our friends and our families and our colleagues, people who have not necessarily been advocates of public health in the past. And to be an advocate doesn't mean that you need to march up to Capitol Hill on a regular basis. It means you need to talk to everybody about the importance that public health plays in their role, in their life, so that they can understand and be educated when it comes time to really take those advocacy steps. A number of people who we're going to be talking to are unfamiliar with the intricacies of public health, don't understand the role that the Prevention Fund has played in their life, for example, even the role that many of the regulations that we focused on in the last couple of years have played, or the amicus briefs that we've put before the Supreme Court on things like family planning and women's reproductive health. They don't necessarily see that all of these things are public health. So part of our job in the next few years, the next few months actually, will be to educate and inform and engage. And to do that, we have to make sure that we're talking to people in a way that makes sense to them. We will always be an evidence-based organizations. We will always focus everything on science, but you'll see information coming out from APHA that might look slightly different. It might be a little less jargon-filled. It might be more focused on the general public as a way to help you engage your constituent or your friends and your colleagues and your family so that they understand the important role that public health plays. We're going to need to be very proactive and anticipate where the battles are going to happen. So we're going to focus our work, as I said, on a few key areas to start, and still understanding that we are fighting for public health broadly and we're fighting in a variety of different ways. We need to maintain the integrity and reputation of the association as a champion for health and a wise advisor to the nation. Because of this, we will be working with partners and coalitions in ways that will probably be both very visible and not as visible, but know that we are involved in a variety of these fights in ways that you might not see, but we're always happy to talk about. The way that we're going to try, the way that we've started this discussion with these 3 priority areas are really when we're thinking about places where we have a chance of making a difference, or we know the issue is just too critical to not engage. As an association, we're going to have to be better at using consistent and compelling language, and you will see that language in all of the material that we put out about the importance of creating the healthiest nation, about working across sectors, about working with non-traditional partners, and even what is the return on investment on the work that we do. Unfortunately, sometimes it's hard, that information is harder to find than others, but where we have access to that information, we will be offering that to you through the material that we put out so that you can make that case at all the different levels where we will be engaging. Hopefully, another piece of this will be expanding our use of case studies and stories to explain and make our messages more tangible. Many of you have talked to members of Congress or state or local legislators, and you know what they walk away with is not necessarily the facts and figures you offer, but it's the story. It's what impact our work has on their constituents. And that is what we're going to try and help support you by offering information related to that. On the other hand, that is also where we're looking to you. So if you have great information that we can use to help make a compelling story, we really would appreciate that opportunity to receive that so we can help expand its reach and help other people use your great work in the fights and battles that they're having at the federal, state, and local level. So as I said, we're really going to be working with our existing champions, hopefully creating new champions, not creating partnerships with non-traditional allies, and working with the general public through what we call Generation Public Health. We will need data, we will need examples, and we'll need stories that appeal to people inside and outside of public health. And again, this is where I'm appealing to you. Even though the information that we're putting out might be targeted to the public health community, part of the service that we will provide is that translation of information so that you can share it with folks and make it easy for them to understand, and make it easy for members of Congress and staff to understand who, again, are not steeped in this issue in the same way that we are. Just in the short term, some of the tools that we will be offering are updated action alerts for the Affordable Care Act, the Prevention Fund, public health funding more generally, climate change, and health and all policies. We have, as I said, op-ed templates and sample letters to send to legislators, but if you want those op-ed, those templates, we ask that you contact us directly. Those are not going to be available on the website for a variety of reasons. The biggest of which is that we find that papers are more likely to actually use these op-eds if they think they are more original, and they're not going to be original if they're already posted on our website. We will have talking points for the Affordable Care Act. We have on our website, we have a number of pages and links related to the health reform and these other issues, as well as fact sheets on climate and health impact. Some of these things are still in process. You'll see them soon, but as soon as we have them available, we will send them out to you. The truth and the bottom line to all of this is we need you now more than ever. There's one thing that is absolutely essential. It's your participation and your voice. Please, all of you, make sure that you renew your membership over the course of the year. Tell your friends to renew their membership. Tell your colleagues to become part of Generation Public Health. We really need voices to take action on our action alerts, get engaged in our member groups, and attend the annual meeting this fall in Atlanta. If we hope to protect and build support for public health, especially right now with the many threats that we face, we need to strengthen the voice of public health. I ask you again to reach out to everybody who you think would be interested in becoming a member. APHA is the only public health association that influences federal policy, has a 140-year plus perspective, and brings together members from all fields of public health. No one else does the work that we do at APHA. No one else does the work that you do as part of the public health community. So with that, I want to thank you and turn it back to James for the first questions.
Thank you, Susan. Now we'd like to open things up for questions from the audience. To submit questions, you can either use the comment box in the Google Hangout, or you can use the hashtag APHA webinar. Our first question is, in terms of the Affordable Care Act, what are the likely next steps for repealing the law, and what's the best possible outcome?
So let me take that one, James. You know, obviously, the step that Congress is doing right now is to try to do things through budget reconciliation, because which will affect the finances of the Affordable Care Act. The upside on the legislative part of that is that they can do that with just a majority of votes in both houses. And they have to have a president who is willing to sign that legislation. Now, in order to get any of the actual programmatic parts removed, that's going to require in the Senate 60 votes, and of course a majority in the House. And the challenge with that, of course, is that there are certainly members of Congress who are beginning to more and more to recognize what the downside is to undermining the Affordable Care Act as it is. So, you know, the pathway forward is for the folks that are trying to move and undermine the Affordable Care Act, while 8 months ago may have been clear to them, I think it's much more perilous for them. And so I would argue that today our quest should still be that we demand that they fix, not repeal, the Affordable Care Act. That means strengthening the health exchanges. That means looking at ways in which they can continue to incentivize people, particularly young, healthy people, to get their health insurance coverage. Cost is very important. Continue to look for ways to reduce costs. Now, you know, as you know, one of the reasons that it's so difficult to repeal and replace the Affordable Care Act is that everything historically that the opponents of the ACA would have been putting in a new bill are already included in the Affordable Care Act. And that many of the things that, from a variety of policy reasons, don't work real well, that were left out, are some of the things that they now want to put back into any kind of health insurance reform. So having insurers buy insurance across state lines in the current construction doesn't work real well. Making these large funds to fund the uninsured, that experiment has failed many times when it's been tried. The fact that people think that simply malpractice reform is going to solve all our problems. I happen to think that we probably need to look at malpractice reform for sure, but the solutions that they've proposed so far really haven't worked. So, you know, the problem is that first, we need to make sure that people understand that there needs to be a viable solution to fixing the Affordable Care Act. And you may call that repeal and replace, but at the end of the day, they just have to fix what we already have. And so now trying to fix it is going to be really the task. And we need to convince them to leave it alone from a repeal perspective and move to a fixing mode. I think it's the most important message that we need to get people to have. Now, I know you hear a lot of people talking about don't repeal until you have to replace. And I agree with that as an important strategy. But I think we need to start from holding the line that the Affordable Care Act, while not perfect, is a whole lot better than what we had before. And that this concept of going from insurance to simply access to care, which is kind of the mantra, doesn't really work, because access, as we all know, in this country requires a get into the system card, which is why insurance works and why we kept an insurance model. Now, clearly, if we had a white sheet of paper today and we were starting all over again, what we would be saying is Medicare for all. But that it's still not yet on the table. But I think that if they're not careful and they repeal this thing without replacing it with something meaningful, which truly can get universal coverage and can bring everybody's costs down, then we have a solution for them. And it turns out it's Medicare for all, because that's the only thing that will do everything that the proponents for getting rid of the ACA, they haven't proposed that, but it's the only thing that will work. And all the things that they put on the table as these little pieces of things that were left out of the ACA for really good, sound public policy reasons, they now want to try to put in there. Not that for some people in some populations, some of those things might be okay, but doing it as a full replacement for the Affordable Care Act is just not going to work. So my point is that we need to, right now, we need to make sure that every person in this country understands the benefits they do get today from the Affordable Care Act, understand that if they undermine the very financial underpinnings for this piece of law today, this program, that they will put the health system in ultimate chaos. And if you think the bank problem we had, the financial collapse, was a problem, you ought to think what happens if you undermine 17% of our gross domestic product and the one place where people go to actually make sure that when they get sick, they can get health care. And prevention components of this that prevent people from getting sick in the first place. You think that the bank problem was a problem. Where do you create chaos in the healthcare system and people start getting prematurely dying, are unable to get the health care that they need? There will be a clamor that you will not believe in this country to create a new system. And we have a system for them on the shelf. So I would argue that let's make if they don't want that, which okay if they do, but I think they ought to fix the Affordable Care Act. And I think we ought to stand firm that the ACA is here, it's working, and we need to find ways to make it better. But if you don't like that, we got something for you. And it's called Healthcare for All, and it's called Medicare for All.
Thank you, Dr. Benjamin. Thank you, Dr. Benjamin. And I want to remind folks that if you do have a comment, you can use the chat box in the Hangout or the hashtag APHA webinar. The next question: how can APHA sections and other member groups participate in the Year of Climate Change and Health?
Let me pass it on to Susan, and then I can pick up if Susan needs me to add to that.
Sure, thank you. So over the course of the next 10 months, with each month we're going to have different priorities that we're going to be focusing on as part of the Year of Climate Change and Health. Even before that, though, there are a number of opportunities for sections to get involved. If you look at the things that are important to your section, to your component, think about how the climate impacts that. We're going to be offering you a full variety of tools and talking points to help with that discussion, but part of it we ask you to think about from your perspective, from your expertise, the impact that climate change would have. And we will be through a variety of different mechanisms, we will be doing education, but we ask that you think about how you can further that. Think about at the annual meeting where you might want to try and coordinate with other components to put together sessions. Think about how, if there are op-eds that you want, think about if there are ways that we can support your work here in Washington. If you have information about that really connects the concept of climate change and health, those are really great stories for us to use to help further that discussion at the national level as well. Dr. B?
Yeah, and let me add, I think let's each and every one of you ask yourself what you can do to reduce your own carbon footprint. Your own personal one, your carbon footprint in your home, working with your employer to reduce the carbon footprint for your employer. We're working very hard here at APHA to reduce our carbon footprint as an employer and through our products. We just recently had a climate and health summit here in the building where we did lots of things to try to reduce our carbon footprint just for the meeting, where we brought in lots of partners to begin thinking about what they can do around addressing the issue of climate change and health. And then, as Susan said, this is now the time to push the concept of this in the media. Writing letters to the editor. We've got great policies, and you don't have to wait for the national office to act for you to act. You can pull those policies. You can advocate on your own. You can talk to your local elected officials. You can talk to your family members. You can get them engaged. There are just many things that you can do to try to make this issue of the impact of climate change and health very important. And on the advocacy front, we know that there are going to be efforts to undermine the regulatory activity of many of the federal agencies that have occurred over the last, not just 8 years, but the last 20 years or so. And I just remind you that many of our presidents over the years, in a bipartisan manner, regardless of party, have been promoting environmental health in our country. And it's only been recently that we've seen this as an issue that both parties have not really been strong supporters of. So we want to return to the fact and the point in which everyone recognizes and uses the science to understand what our environmental risks are. And climate change is such an example of that. It impacts everyone. Climate change does not know party affiliation. It does not know race. It does not know ethnicity. It disproportionately impacts vulnerable populations. But it does not know who you are when a tornado or a hurricane or a severe storm hits your community. Your ability to respond to that may be based on your resources. So we want to make sure that all of our policymakers know that, and our advocacy efforts are designed to do that. But let's all walk the talk. And so to the extent that we can continue to do that in a productive manner, just want you to know APHA is strongly in support of that. And you will see that as we continue to move this agenda forward to make sure that we reduce the risk to our health around climate change.
Thank you, Susan. Thank you, Dr. Benjamin. The next question comes from Michelle Edwards. What should we call it when we say we are in favor of fixing rather than repealing the ACA? What words or semantics should be used? Is it called amending the law?
I think that we should say, let's fix the Affordable Care Act. Let's not return America to a time when people were sick. And don't make us sicker. Let's make us more healthy. The APHA strategic direction is for us to become the healthiest nation. And so what I would say to that is for you to go to the legislators and say that we are on a quest as a nation to become a healthier and, in fact, the healthiest nation. And in order to do that, we need to do a variety of things. And the Affordable Care Act is a major part of us doing that. So let's not make America sick again. I know that's a slogan, but fix the Affordable Care Act. Don't destroy it.
Thank you, Dr. Benjamin. The next question, infrastructure and jobs are priorities for the new administration. How can we make sure investment in public health is part of the solution?
Well, I'll take it first and I'll turn over to Susan. The built environment's a very important part of making sure that we have a walkable, bikeable, and green communities. And so we know that infrastructure is a big issue. We saw that in Flint, Michigan. And by the way, Flint is only the tip of the iceberg. We know that there are many of our aging cities that have lead problems in their water. We also know that we have bridges that need to be fixed. And if a bridge is collapsed and people are injured, that's a health issue. We know that we have lots of aging facilities that need to be fixed. Schools that are old and worn down and need to be fixed so that kids can learn in a safe and healthy environment. So we've got lots of things that we can do. And as the administration begins to craft whatever it intends to do around infrastructure, we need to make sure that there are important provisions for health in that. And that we make sure that if they're going to build roads, that those roads are built so that they're safe roads. And that they build new communities, that they build sidewalks so that people can walk and get out and exercise, that they build communities that have lots of green space. So thinking about how they use those infrastructure dollars in a way that promote health, that we build places for roads that move people using their cars versus designed primarily to move the cars. It's going to be very, very important. And again, if you go on our website, you'll find information around the built environment. We are partnering with lots of groups around the country. We have a very important partnership through the American Planning Association right now that works with some of our affiliates to make sure that we're thinking about how we can engage in any kind of infrastructure projects that happen, particularly through the planning process. So we are very, very much involved and engaged with that. And with that, I'll turn it over to Susan and see what else she has to add. But I think that's the important part of us engaging the administration in any funding that they do for infrastructure.
And I would just add one thing, that along with building communities that are walkable and bikeable, have green space, are safe for people to live, work, and play, that also think about one of the things that we'll be focusing on is making sure that the communities have a transit orientation, so that there's public transportation that is accessible to all people in all communities, and it's an expansion of existing transit or building new transit, or even using buses that are environmentally friendly. Just making sure that as all infrastructure is being developed, it includes that important component of giving people options for traveling from one place to another.
Thank you, Susan. Thank you, Dr. Benjamin. The next question: between the administration, Congress, and Supreme Court, women's access to reproductive health services hangs in the balance. How does this fit into APHA's agenda?
You know, it's very much near the top of our agenda. Let me tell you, we've been, as you know, we've been strong supporters of women's access to reproductive health services. That's one of the reasons we had Cecile Richards speak at our annual meeting. As you know, she spoke with great passion about the importance of women's access to healthcare broadly and women's reproductive health services specifically. Let me add to that, reproductive health services for men as well. Now, we know right now we have a virus that's circulating primarily in a few southern states that dramatically impacts the health and well-being of both women when they're pregnant and their unborn fetus. And, you know, so this is not the time to step back on family planning activities, women's reproductive health activities, infectious disease and disease surveillance activities. We would like to make sure that women are not denied services. Pushing back against the Affordable Care Act will dramatically impact that. Pushing back on efforts to ensure that we have members of particularly the Supreme Court that will look at the facts and make sure that women are not denied reproductive health services is going to be very important to us. And so we will continue to, as we've done in the past, to partner with others around amicus briefs to make sure that the health and well-being of women are protected, both from a policy perspective, from a funding perspective, and from a legal perspective.
Thank you, Dr. Benjamin. Another question: APHA has a broad agenda, yet you're talking about focusing on a few priorities. What will happen to all the other issues we work on?
Well, we work through issues in a variety of ways. And I've always argued that if you're for everything, you're not for anything. And so we've decided to focus our efforts on a few things that we know are the highest priorities that give you the best bang for the buck right now in terms of time and effort, things that we know are right now in front of us. I mean, the repeal of the ACA is right here in front of us. Efforts to push back on climate change are right here in front of us. As we just asked, women's reproductive health, right here in front of us. We know that these are things that are going to be hitting us each and every day. In terms of our funding, us pushing very hard for funding for the Center for Disease Control and Prevention, the Health Resources and Services Administration, us making sure that they're adequately funded in many ways focuses on our vast, and I mean vast, policy and priority agendas. Just think about many of the REACH programs that specifically focus on health equity programs that CDC has done. If CDC doesn't have the resources, the REACH programs will go away. If HRSA doesn't have funding for community health centers, then access to healthcare services go away, as well as a whole range of preventive services, whether it's screening services for breast cancer, for colon cancer, for prostate screening. All those efforts go away. Our core efforts around infectious disease, making sure that we have, CDC is the disease detectives for the world. And if it doesn't have the resources to protect us, we're going to be in trouble. If we don't have the capacity to have strong health departments that can tell you when a new disease threat enters the community, whether it's infectious or whether it's, foodborne, we don't know if that threat enters the community, then we're going to be in really severe problems. We're going to be sicker. We're going to be paying a lot more money on the back end trying to clean these things up. And so funding is going to be a very strong part, and has always been a part of our advocacy efforts. As we think about these efforts and we begin to see who goes into these various jobs, our meeting with them and trying to advocate for our priorities, convince them that we're right, talk about the history, the science, what we know works, and try to build partnerships with both the Congress and the incoming administration, because we've been around since 1872, and we have partnered with both sides of the aisle since 1872, and of course we will continue to do so. We're 501c3, we're nonpartisan, but you can be darn sure that we know where our priorities are, and our priorities are to protect the health and well-being of the people in our country, and to the extent we have a global reach, the health and well-being to the people of the world. And we're not going to change that perspective for anybody. So that means if that you're not for the public's health, then we're not with you. If you're for the public's health, then we're with you, regardless of who you are, regardless of what you may have said in the past. We'll give you a chance, but you've got to be for the public's health, and then we'll support your programs.
Yes. Okay, our next question is from Mark Horton. Where can we find a list of specific programs and services that are funded through the Prevention and Public Health Fund?
I'll start that. There are a variety of different places that you can find that. We have some of that information available. If you go to our website, you can look for Prevention Fund, you can find that. Trust for America's Health has been monitoring that. The Centers for Disease Control and Prevention have also been very clear about the money that they receive that comes from the Prevention Fund. As Dr. Benjamin mentioned, 12% of the current budget comes from Prevention Fund. So there's a number of different places where that money has been distributed, and we can really, and we can offer, some of that information is readily available. If you are not able to find it, please feel free to contact me, and I can make sure you get those links.
Yeah, and I think we'll try to find where the most coherent document is and make sure that that gets put into our next Inside Public Health so that all our members get it. Mark, for your purposes, I would suggest good to know you're on the town hall. It's good to hear from you. But I would encourage everyone to start, as a place to start, is to go to the Trust for America's Health website. And on their website, they have a document that has specifically looked at the prevention fund, and they've looked at it at state by state. So what it will tell you is what the funding has been and some of the things that by state that the prevention fund has supported. And then we can see what we can get, because CDC does have a document that I've seen that talks about current funding and where it went, and recognize that over the years, of course, as it always does, the funding changed year to year. One of the real challenges we have, of course, is the fact that the prevention fund has been used to supplant base funding for CDC. So that again, if that funding goes away, about $1 billion, about 12% of the CDC budget just vanishes into the air, and its current funding stream, which was mandatory funding, which had been diverted to things like MACRA, which is the Physician Payment Reform Program, and the 21st Century Cures Act, are also at risk. So folks that, while we've also been very concerned that money was diverted to those two programs, those folks that are being supported by those programs should also be very concerned about the loss of the prevention fund as a mandatory funding stream, because it does support their programs as well.
Thank you, Dr. Benjamin. We have another question from Russell Morgan. Many APHA members are employed by local, state, or federal governments. If APHA members challenge the new political positions, how can they do this without jeopardizing their personal employment?
Yeah, I remind you, you don't lose your right to be a citizen because you work for government. Now, depending on what your job is, it may not be wise for you to do that as an individual. But I can tell you that you've got to decide what you can do within the environment that you're in. But remind you that that's why we're here, because we are the collective voice of public health. And so you let us speak for you. But now that means that you need to certainly be a member, encourage others to be members. And to the extent that you can speak out within the context of what you can do what you can do. But you can actively support us to speak for you. And I understand that. I've been both a health official in the state of Maryland and the health officer here in Washington, D.C. And there were times when, as in my official role, there were things I couldn't say. But my professional organization spoke for me. And I aligned and looked at those views, and I supported those positions, which were certainly in line with what I wanted to do. And by the way, I know that all of our members don't necessarily agree 100% with all of our collective views. And that's to be expected. We're a very diverse country. We don't all think alike. But I think if one steps back and works as hard as they can to make sure, as a way of educating your local officials around the impact of what happens if the prevention fund goes away or the Affordable Care Act goes away. In most cases, you can do that without politicizing it, because you're providing information. And it is true that if the prevention goes away, fund goes away, the money goes away. So what's that money being used for in your community? And then they can make an informed decision. So all we're really asking you to do is make sure that your elected officials, your policymakers, and even your own colleagues within state and local government understand what the facts are, so we can break through some of this false news, some of this misperception about what things happen and don't happen. I've always been amazed at the number of parts of the country that support the health exchange in their community because they don't know that it is part of the Affordable Care Act, that it is quote unquote part of Obamacare. It was fascinating watching our good colleagues in Kentucky, and I pick on my good friends in Kentucky because that's the best example that I have, where you had a certain member of Congress supporting Kentucky Care, but railing against Obamacare. And yet it was one of the same. The number of people that don't realize that the reason they're on their parents' insurance plan is because of the Affordable Care Act. The number of people that don't realize that their insurance would have gone up more if there wasn't for the Affordable Care Act. That maybe that their insurance leadership didn't really negotiate the best deal because there's a lot of negotiation that goes on those rates, and that many of the states that negotiated really good deals for their citizens got better rate deals. The fact that there were some members of Congress that pulled the rug from under the funding to cover the uninsured and for some of the funding for the health exchanges. So that's part of the reason that many of the insurers left those markets, was because they pulled some of the funding already from the health exchanges. So we need to make sure that people understand that this thing is designed to work. It still has some flaws, but if people really look at the facts and, remember that old famous picture of people saying, keep the government's hands off my Medicare? We need to make sure that those folks know that Medicare is the nation's single payer universal access program for seniors. And that it works, and that it has low administrative costs. So these government programs can work, but they require a bipartisan engagement of people who care first about the health and well-being of the American people, and then park the politics and really work hard, roll up their sleeves to make this thing work. And so that's what we're encouraging people to do. And so I noticed that as we're getting people to think about this, now's the time not to be silent. This is not the time for good people to be silent. This is now the time for good people to speak up. And I realize you have to do that with the constraints of maintaining your job within the rules of your employer and your employment. But we can do that by simply educating people and not politicizing this, both in our rhetoric and our approach.
Thank you, Dr. Benjamin. I know we're running up against the 4 o'clock hour, but there is one last question from Twitter that I think is important for you to address, and then we'll wrap it up. So Dr. Benjamin, very succinctly, if you could please answer, does APHA have a position on any of the new administration nominees?
Yes. Very, very clearly, we have some concerns about the Secretary of Health nominee. We have, because of many of the policy positions that he has, we're really excited that the president-elect has nominated a physician to run the department. We've always felt that having a clinician in that role is an opportunity, and so we're happy about that. But we are very unhappy with most of the public policy positions that he's taken. Secondly, we are extremely concerned about the nominee for the Environmental Protection Agency. Frankly, he has not been supportive of climate change, and we think is a very poor choice for that position. Third, we have some concerns about the statement made by the nominee for the Office of Management and Budget, who does not believe necessarily that the federal government should be involved in funding science-based research. We think that he is wrong. And again, but should any of those 3 individuals be confirmed, obviously we will roll up our sleeves and try to convince them that we're right and that they need to change their perspectives on things. That's what we've done with every administration that we've worked with so far. We haven't quite decided who we're going to officially support and not support. but we are looking forward to making our positions well known about our opposition to their policy positions. As they're actually coming up for their confirmation hearings, as you know, neither one of those three yet have come up for their confirmation hearings. We do plan to weigh in at some level.
Thank you, Dr. Benjamin. And with that, that concludes today's town hall. On behalf of Dr. Benjamin and Dr. Pullen, I want to thank everybody for attending and really for everything that you do to help APHA improve the health of the public. I want to mention that an archive of today's APHA town hall will be available on the APHA website soon. So make sure you tell all of your colleagues to visit the website and view the town hall. Be sure to visit the APHA website, apha.org, for more information on our top priorities. For materials on the Affordable Care Act, visit apha.org/health-reform. To get involved in the Year of Climate and Health, please visit apha.org/climate and visit apha.org/healthiest nation to become part of Generation Public Health and help APHA create the healthiest nation in one generation. Thank you for being with us today. Have a great day.